This is a presentation on skin cancer by Caitlin Franson and Carmen Bekovic.
What is skin cancer? Skin cancer is cancer of your skin cells. It can show up as a new mole, a spot, a lesion, or a bump. It forms by abnormal cell growth, and it is the most common type of cancer.
There are three main types of skin cancer: melanoma, squamous cell, and basal cell. Melanoma is the most dangerous and it can look like a new mole. It develops from melanocytes, which are the cells in our skin that produce color. You can use the ABCDE rule, which we will talk about later, to help identify it. It can appear anywhere on the body, even on areas that aren't exposed to sun. And like I said, it's the most dangerous. Squamous cell carcinoma comes from keratinocytes in the epidermis, which is the outer layer of our skin. It can look like scaly red rough patches, and they may bleed. It can form a sore too, and this will be on sun-exposed areas. Unlike melanoma, it will not be on areas like palms or soles of your feet. It can be potentially dangerous, but not as dangerous as melanoma. Basal cell carcinoma comes from the deepest layer of the skin, and it can look pearly or waxy, and it can happen on the face, nose, ears, or neck, and it doesn't metastasize like melanoma does.
Risk factors. Three of the biggest risk factors for skin cancer are a family history, Fitzpatrick skin types 1 and 2, or frequent sun exposure. Fitzpatrick skin type 1 is skin that always burns and never tans. Fitzpatrick type 2 burns easily and tans with difficulty. Additionally, weakened immune system and over the age of 50 are other risk factors for developing skin cancer.
The ABCDEs of skin cancer are a way to diagnose skin cancer and perform a self-examination. A is for asymmetry. Does it look symmetrical? Are the sides the same? The border is looking at if the edges are irregular. The color is looking at if it's the same throughout, or are there more than one colors. The diameter is looking at if it's bigger than 6 millimeters, and evolving talks about how it's evolved in size, shape, color, or overall appearance.
Assessment data. Going through an assessment with a patient, some subjective data that you'll collect is history of skin disease, changes in pigmentation, changes in moles, pruritus, which is itching, or a reported rash or lesion. These are all going to be reported by the patient, where objective data is going to be color that you notice, temperature, texture of skin, any lesions or wounds.
For patient education, you're going to want to tell your patient to wear SPF daily, perform regular skin exams, know the ABCDEs of melanoma to identify within yourself, limit sun exposure, and avoid tanning beds. You can ask your nurse how to perform self-exams if you are at an increased risk for skin cancer.
Some education modifications. If your patient has vision impairments, ask them to have a friend or a family member help them with their self-evaluations for skin cancer. If they are intellectually impaired, it might help to have them have someone assist them. And then if they have extra fair skin, recommend frequent exams.
And here are our references.